So I put the document that I'll reference in the chat. The document shows you, well, first of all, good morning, happy Friday. My name is Jill. I am the Youth Suicide Prevention Specialist, coordinator at OHA in the children's same team as Fran, who's right here in my Brady Bunch square. Good to see you this morning, Fran. I'm a mother to 4 Oregonian children. Well, my oldest is 20, but she's still quite needy. Just kidding. And I come from a background of school counseling for 10 years and did restorative justice in juvenile justice before that, doing victim offender mediation. So I am, you all are my people. And I'm married to an educator who is normally a PE teacher, but this year is health, PE, music, and about to be a first grade classroom teacher. I don't know, life is weird. Yeah, so I am one of 2 youth suicide prevention coordinators, and what we have worked really hard at doing is building an infrastructure in our state that folks have ability to access evidence-based good programming that we've vetted at low or no cost. And so the structure that we've built includes train the trainers and then paying for whatever cost to get certified in whatever training that we have, as well as a statewide coordinator for that particular program. And so I'll show you the programs here in a second and highlight the ones that we're most excited about. And if you have questions, I get really yappy. I also don't know how much time I have. So if somebody could tell me that, that would be helpful context.
It looks like we have just if we could have enough time for district discussion. Kara had some follow-up questions of district need and wants, so maybe 10 minutes for that. So can we do like 10, 15? Would that give you enough time?
Yep, I can do 2 minutes or 2 hours. I get very chatty. So that's the structure. That doesn't mean there are no costs. So for school-related folks, sub pay, per diem if they're in-person training, if COVID ever takes a hike, and then the time, which is the most valuable thing in a school setting anyway. So we don't pay stipends or anything like that for trainers. But what this means is that we're building really robust trainer pools in lots of areas around the state. And so every time we hold a T for T, we look at the heat map of where our trainers are and where we need to fill in the gaps. And so we're hopeful that as we continue building, that it'll be the coverage and the saturation for each of these programs will be available. Also of note, we have COVID is hard. Newsflash, it is the weirdest time ever. And yet, and still, we got our finalized youth suicide numbers for 2019 about a month ago. So it's an 18-month lag to get the fully finalized numbers for a multitude of reasons. But 2018 represented the highest youth suicide rate in Oregon's history. 2019 saw a decrease in youth suicide for the first time since 2015. And in 2020, with our preliminary numbers, we estimate that we'll see an additional decrease over 2019 in 2020. So 2018, 2019, 2020. And so what that indicates to me is that something about what we're doing is making some sort of difference. And we all have to lean in and keep laser focused because Oregon continues to have above national suicide rates for youth and lifespan. But there is prevention to be done. And so it's both head work and heart work for me. I know we can do this better and figure out a system that creates more safety for kids. And as a mom and as a sister to someone who's an attempt survivor, I know in my heart that all of this matters too. So that said, here is my shiny new flyer that I'm just very excited about. Let me see how, so this is a PDF. How do we make it not obnoxious for you all? Let's see. Well,
your link in the chat worked great. We can access it.
okay, so just look at it with me and do the double screen, and I won't share then. Okay. So often in suicide, we talk kind of in this analogy of a river, and that's helpful in context about what each of these programs are meant to do. So often we kind of think about it in context of really upstream, way away from a dangerous point in the river, which is represented in this graphic by the waterfall moment. What are the things that we can do way before we get to the point of danger or even death in suicide? You'll notice that those are represented here for wellness and coping skills. So we've leaned hard into kind of four main areas here, and again, there's lots of work to be done. So I'm not. But this is better than what we've had. So, so here we go. Sources of Strength has an elementary curriculum for grades 3 through 5 that we have bulk purchased. So any elementary school in the state of Oregon that is interested in this programming, it's once a week classroom lessons specific for suicide prevention. So it should complement an SEL program, not replace an SEL program. But it does a really good job of emotional regulations, recognizing big emotions and interacting with them. Oh, yes, tell me the typo. Thank you. I also am a licensed school counselor, not an LCS, whatever an LCS is. Oh, that was a private message. I'm so bad at Zoom. This is, you get me. This is who I am. Just, you're gonna have to deal.
Licensed social worker?
No, licensed school counselor.
Oh, school counselor. Okay.
Yeah.
Okay, got it.
Yeah. So the elementary classroom curriculum for Sources of Strength pairs really nicely with 5 Radical Minutes. 5 Radical Minutes is an elementary curriculum it's plug and play. You literally just open up and you get a list of prompt questions. It's available K-5. And there's no training or anything like that that's needed. Again, Oregon bulk purchase, so that any elementary school in the state of Oregon has free access to this really expensive program. It's meant to be kind of a small, frequent dose of connection. So kids get prompts to talk with one other student, and there's a whole kind of map, a scope and sequence of when they talk about feelings, they talk about a time that they felt loved, all sorts of good kind of just becoming a well-rounded human pieces. And so we think those two pair really nice together. The once a week classroom lessons paired with a daily dose of the creator of that 5 Radical Minutes calls it building an enduring moral compass of kindness. And I just really like that, that thought for children. Sources of Strength, the next one over is available middle and high school. It is not without the need for a champion in a building. So Sources of Strength Elementary can be done with, there's some buy-in that's needed, but it's way less time intensive. Sources of Strength is meant to be a fidelity model of either a class or a club on a campus where you train students to be messengers of hope, help, and strength. Yes, Sherry, and she presented at OSCA at the school counselor conference a couple of years ago. You might remember her. She does the crisis counseling thing. I just remember she made everybody dance and it was very awkward. I don't know who else was there, but yes, Sherry is the 5 Radical Minutes founder. And then mental health first aid, often folks have heard about that. The module that we recommend for schools obviously is youth mental health first aid. So that's to train adults in kind of I call it a inch deep, mile wide in mental health. So it's just kind of understanding when things might surface and some very, very high level pieces of information about mental health. That's good for school administrators and health teachers. We have a support team called the School Suicide Prevention and Wellness Team that pairs with Kara's School Safety and Prevention Specialist to support when more suicide prevention planning is needed in districts. QPR, and so now you notice we're entering into like when there's trouble. So now we're seeing warning signs and there's a need to screen and refer. So we're getting closer to the waterfall moment. QPR is quick and easy. It's an hour and a half. It's really, like, truthfully, it's nothing special, but it's cheap and it's easy to get everyone trained in. So QPR should be what everybody takes in a school setting: bus drivers, coaches, classroom teachers, cafeteria workers, parents. And again, it's an hour and a half to teach you what signs to look for, how to ask the question, how to get the bridge between referring and then where to get that person who's having thoughts of suicide to someone who can do risk assessment and safety planning. I'm going to pause for a second and see if there are any questions so far, and then carry on. Brooke.
Did you say that sources of strength and is free for all elementary? And then do we email you for that, or how do we access the funding to order that?
That this document is clickable, so all of the icons link to the coordinator attached to those programs. And so if you click on the elementary curriculum, it'll take you to Sources of Strength Oregon, and they have a tab, elementary. I think it's on their homepage that you click on the elementary tab. They have an interest form to fill out for that one. There's also a recorded information session, so you can learn more about it on their website.
And then ordering information is there. Do we have to put in any type of code to indicate that we're an Oregon district, or do they just?
No. So
Okay.
we have, because of the coordinator piece, because we also are funding a human to kind of shepherd schools to those programs. They'll reach out to you, and so yeah, they'll know because of your email address would be my guess. Yeah. Liz is amazing, the director of Matchstick Consulting. She's like who I want to be when I grow up. Does such a good job. And they just hired an elementary coordinator for the elementary program. That's our newest addition to our river. So any other questions?
Question. Yeah, I have a quick question. So the resources on this flyer, besides the one that says elementary curriculum, are they all for just K-12, or do they extend beyond to, I'm just wondering, for students coming out of high school or early years, just families? I'm just thinking of like a family resource as well.
Yeah, so our funding prioritizes any youth serving entity, and youth in the state of Oregon is 24 and younger. So that's our zone. We also we're not about, so I'm not very good at being a government employee so far, in that, like, I'm not about, like, I don't care that much if people are learning. It's applicable skills for your marriage and your parenting and your community. So most communities have people that are interested in helping support these programs as well. And so lots of communities have like a suicide prevention champion that's also an assist trainer. And so we're getting better at trying to get people to talk to each other and coordinate all the things. I just want to name two specific: Youth Save. So as we get farther along, they're kind of more advanced skills, essentially. Youth Save, we are incredibly proud of, and should be. Oregon Pediatric Society, and the Oregon Association of Community Mental Health Programs, with funding from our program pivoted in COVID to develop this. This training, it specifically teaches you how to do a suicide risk assessment and a collaborative strength-based safety planning process with youth. And so, and they mapped out the curriculum to include how to do that in a virtual space, which those skills are then, of course, transferable in an office someday as well. That program has been wildly successful. We still have almost a 600-person waiting list from people who have registered for it. And by people, I mean school counselors, school psychologists, mental health professionals. And so we knew we got it right and asked for people's patience, and we're training as fast as we can train and keep asking for more money to increase capacity with that. The SSAL, this life preserver situation, that's a line available to schools for suicide safety, risk assessment and safety planning during school hours. So if a school doesn't have a school counselor that feels equipped to do a risk assessment, or an administrator or another person connected to a school, that line gets you to somebody who literally can do that for you in collaboration, and three-way call-in parents and all of those types of things. So that's a free resource as well that we added in for COVID. And then I expect this advanced skills section. So you'll notice all of the acronyms. These are expensive trainings to get. These are for intervention, like treatment of suicide. And so some of them may or may not be more appropriate for schools. CAMS is collaborative assessment and management of suicidality. They have a teen component as well. That one might be one that would be good for school related folks. The cognitive behavioral therapy piece has a suicide prevention module and a depression module that we've paid for. That might be a good one. And then DBT, dialectical behavioral therapy. As a school counselor, when I took the skills training, so DBT is a huge evidence-based therapy style, but there are pieces of it that pair really well with school environments, and teaching people how to regulate and not just like a take deep breaths, which is important to take deep breaths, but really solid evidence-based skills, that DBT section. So, and again, click on that link to get you to the association of to the people coordinating those efforts. Then the last one's connect postvention. So sometimes our best efforts are not enough in a kid's life, that we just didn't intervene and equip at the right moments at the right times. And so it's also super important for schools to know how to respond in an evidence-based caring way after a suicide death. And postvention is prevention. So kids connected to a suicide death are the most at risk in the after of a suicide death. And so we need to know how to respond appropriately in a caring way. So that's what we've got. 10 minutes.
Jill, thank you so much for these resources. This is amazing. I think that districts, have some things in place, but it's always great to have more tools in our tool belt. So, and for those that don't have any resources, this is wonderful too. So thank you for sharing. Does anybody have questions for Jill?
I have
Jill,
a quick
I was
question.
wondering, I was wondering, at